bring report evidence for camel to human transmission of MERS coronavirus. Definition: MERS-CoV is a new identified human coronavirus that has recent emerged in the Middle East region. One and three current epidemiology suggest multiple scenarios: transmission from an animal reservoir, leading to human infection, sometimes with secondary transmission even in humans.
Middle East Respiratory Syndrome Coronavirus, or MERS-CoV, emerged in the Arabian Peninsula in 2012. Since then, it has sickened more than 1,000 people, killing approximately 30% of those it infects.
My group is interested in understanding how new viruses emerge. So whenever something new pops up into the human population, either from a wildlife reservoir or a domestic animal reservoir, we're immediately very interested.
Dr. Vincent Munster and his colleagues at the National Institute of Allergy and Infectious Diseases were among the first groups to begin studying MERS.
We show that this virus targets the lower respiratory tract, so it efficiently replicates in the cells lining the lungs, and that's how it causes disease.
Their latest study provides experimental evidence that camels are the primary source of transmission of the virus.
The identification of dromedary camels as the reservoir for MERS-CoV is an extremely important finding and allows us to target who and what people are at risk for contracting MERS-CoV. This virus is predominantly shed from the upper respiratory tract of dromedary camels. This indicates that direct contact or maybe even aerosol transmission from camels to humans is a potential route of transmission.
Application in nursing. In the study, we describe research transcredited pulmonary chain reaction, RT-PCR detection, isolation, and sequences of MERS-CoV from camel and from a patient due date of laboratory confirmed MERS-CoV infection in the Jeddah, Saudi Arabia.
The World Health Organization has confirmed that evidence is growing on person-to-person transmission of the deadly new coronavirus. The news comes as a second case is reported in France. The new infection was discovered in a patient who had shared a room at this hospital in Valenciennes with the first confirmed sufferer. The SARS-like virus produces symptoms of pneumonia and can lead to kidney failure. Experts are looking at whether it's transmitted via contact or whether it's airborne. There are several incidences where a clear human-to-human transmission was possible. We're talking about a virus that is circulating around specific areas of the globe. As soon as we're capable of dealing with patients in the appropriate manner, the virus poses a very low risk of transmission. Two more carriers have died in Saudi Arabia, where the virus was first discovered, putting the death toll to 18, with 34 cases worldwide. With a survival rate of less than 50%, authorities are taking the threat seriously. French travelers to the Gulf are being advised to wash their hands regularly and avoid contact with animals. Anyone returning with flu-like symptoms has been asked to report it immediately.
Pros and cons. Cons. Camel may act as intermediate has that transmitted the virus from its reservoir to human. The exam reservoir that means the virus in the ecological need has yet to be identified. Pros. Serolate that indicate that MERS-CoV was circulating in the camel, but not in the patient before the human infection occurred.
Camels might be the source of the deadly MERS, or Middle Eastern Respiratory Syndrome, coronavirus that started affecting people last year. The virus has infected 94 people, and almost half of them died as a result. Exposure to animals that have a virus is one way that it can be passed to humans. Researchers from the National Institute of Public Health and the Environment and Erasmus University in the Netherlands looked at blood samples from many livestock animals, including sheep, cows, goats, and camels from different countries. Dromedary camels from the Canary Islands and Oman were found to have low levels of the antibodies that are similar to the MERS virus, which indicates that they might have carried the virus at some point in their lives. Although this data is a lead to find out where the MERS virus came from, Professor Paul Kellum from the Wellcome Trust Sanger Institute in Cambridge and University College London said the definitive proof would be to isolate the virus from an infected animal or to be able to sequence and characterize the genome from an infected animal.
Issue apply in Ecuador that suggests that MERS-CoV causes a zoonotic infection that can infect dromedary camel and can be transmitted from them to humans through close contact.
And now on to some health news. Doctors have found evidence that suggests camels are indeed to blame for a deadly virus that has spread to humans. In fact, a research team at King Abdulaziz University in Saudi Arabia found identical viruses in a man who died of the Middle East respiratory syndrome or MERS and one of his camels.
The man reportedly fell sick after treating the camel for a runny nose. MERS, first detected back in 2012, is a fatal respiratory illness with flu-like symptoms. Some 680 cases of MERS have been confirmed in Saudi Arabia, and 282 people have died. The findings have been published in the New England Journal of Medicine.
Conclusion that suggests that MERS-CoV causes a zoonotic infection that can infect dromedary camel and can be transmitted from them to humans through close contact. Camel may act as intermediate hosts that transmit the virus from its reservoir to humans.
Claims another life, this time in France. A 65-year-old man who had been traveling in Dubai has died from the illness, the French health ministry said. He was the first Frenchman to fall ill from the SARS-like coronavirus. The World Health Organization says the virus, which causes coughing, fever, and pneumonia, can likely be passed between humans, but only after prolonged close contact. Out of 44 confirmed cases worldwide, 23 people have now died, with most of those infected having traveled in the Middle East. A virus from the same family triggered the SARS outbreak in Asia that killed 775 people in 2003.
We're quite concerned about this because, now it is the first clear-cut evidence to indicate that this infection, this virus could be transmitted within a hospital setting. And in the past, when we go back 10 years ago, there are several major hospital-acquired infection or outbreaks in a number of countries. So basically, if this new virus, coronavirus, could be able to transmit between humans effectively, that would be quite problematic.
So what sort of impact could this have? What changes are likely to be made as far as healthcare workers go working with those infected?